It's only a few millimeters long, but in the United States, it can spread some of the most common tick-borne infections dog owners deal with every spring. Before you walk your dog through tall grass without protection this season, here's the honest picture. What ticks actually transmit when it becomes dangerous, and which of the most common owner myths are the most harmful. Ticks don't wait for summer. The black-legged tick, the primary Lyme disease carrier in the U.S., becomes active when ground temperatures reach around 45 degrees Fahrenheit. In many parts of the country, that's March. In mild years, February. Peak activity hits in spring and again in fall. Ticks need three things: humid vegetation, shade, and a warm-blooded host. Tall grass, leaf litter, forest edges, wooded trails, high deer populations. And yes, a well-maintained suburban backyard with deer traffic qualifies. What ticks can actually transmit? Three diseases matter most for dogs in the United States. First, Lyme disease. Second, anaplasmosis. Third, ehrlichiosis. In parts of the South and Southeast, babesiosis, sometimes called canine malaria, is also present. Rocky Mountain spotted fever caused by Rickettsia rickettsii is another serious but less common transmission. In endemic regions of the Midwest and East Coast, tick-borne diseases are not a minor seasonal nuisance. They're a year-round management priority. Lyme disease is the most searched tick-related term in spring, and for good reason. It's caused by the bacterium Borrelia burgdorferi. Not every tick carries it. CDC data suggests the infection rate in deer ticks varies significantly by region, from roughly 20% in some areas to over 50% in heavily endemic counties of the Northeast. Transmission typically requires the tick to be attached for 36 to 48 hours. Remove the tick promptly and you meaningfully reduce transmission risk. Lyme disease in dogs is subtle and slow to announce itself. Symptoms usually appear weeks after the bite. That's exactly what makes it so easy to miss. Classic signs: shifting leg lameness. One day the front left limb, next week the rear right, fever, lethargy, swollen joints, and loss of appetite. In serious cases, kidney disease, sometimes progressing rapidly in a form called Lyme nephritis. If you see these symptoms and your dog was in tick habitat in the previous weeks, call your vet. A blood test provides diagnosis. Antibiotic treatment is usually effective when caught before organ involvement. Anaplasmosis presents similarly to Lyme but tends to show up faster, often within 1 to 2 weeks of the bite. Ehrlichiosis can affect white blood cells and is most prevalent in the south-central U.S. Babesiosis attacks red blood cells. Watch for dark or bloody urine, pale gums, high fever. Without treatment, babesiosis can be fatal. What to do when you find a tick? Stay calm. Don't experiment first. No petroleum jelly, no burning it off, no squeezing it with bare fingers. All of these stress the tick and increase the odds it deposits more pathogen. Use fine-tipped tweezers or a tick removal tool. Grasp as close to the skin as possible. Pull upward with steady, even pressure. No twisting. If the head detaches, don't try to dig it out. The body will usually expel it naturally. Disinfect the area. Note the date and body location. If you're in a high Lyme risk area, some vets recommend saving the tick for identification. Prevention is the primary conversation. There are 3 main categories of tick control products. Topical spot-ons applied between the shoulder blades typically last 4 weeks, though they can be partially washed off. Tick collars, including the most effective options like Seresto, provide sustained protection for 6 to 8 months. Oral medications, Bravecto, NexGard, Simparica, work systemically through the bloodstream, require a prescription, and last 1 to 3 months depending on the product. They're considered among the most reliable options for dogs that swim frequently or live in high-traffic tick areas. No product is 100% effective. The tick usually has to bite before the product kills it. Daily checks after every outing remain essential. Priority locations: groin and belly, behind the ears, between the toes, along the collar line, and around the tail base. Common owner myths addressed directly. Garlic supplements don't protect against ticks and can be toxic to dogs in any meaningful dose. Amber collars have no scientifically demonstrated efficacy. Essential oil sprays are unproven and some are dangerous to dogs. If your dog needs tick protection, use a veterinary-formulated product with documented efficacy and peer-reviewed research. On the Lyme vaccine, a vaccine exists in the U.S. and is one of the only tick-borne disease vaccines available for dogs. The AVMA and most veterinary associations recommend it for dogs in or traveling to endemic regions. The Northeast, Mid-Atlantic, Upper Midwest, and parts of the Pacific Coast are the highest risk zones. Check CDC tick surveillance maps for current regional data. The vaccine reduces clinical disease significantly. It doesn't replace other prevention. Early tick removal still matters. Which dogs face the highest risk? Puppies and senior dogs, because their immune responses are weaker. Dogs that regularly move through dense vegetation, forests, or areas with heavy deer and wildlife activity. Dogs with thick, dark coats. Ticks often go undetected until they've been feeding for hours. Working dogs and hunting dogs in endemic areas should be on year-round protection. Which regions matter most in the U.S.? The Northeast is the highest risk zone for Lyme. Connecticut, New York, Pennsylvania, Massachusetts, New Jersey, Minnesota, and Wisconsin lead in confirmed cases. The Southeast and South Central U.S. carry higher ehrlichiosis and Rocky Mountain spotted fever rates. Babesiosis has its own distinct geographic spread. For current, precise regional data, the CDC maintains a tick surveillance map that's updated annually. Use that, not general advice. When do you call the vet? Immediately. Fever, sudden lameness or stiffness, profound lethargy, dark or bloody urine, pale gums. Within a few days, unexplained appetite loss, unusual tiredness, behavioral changes following known tick exposure. If a tick was attached and engorged, meaning it had been feeding for a significant period, a blood test 3 to 4 weeks later is worth considering even without symptoms. What every dog owner should take from this? Ticks are not a seasonal inconvenience. In endemic regions, they're a genuine year-round medical risk. But the risk is very manageable with a veterinary-approved preventive systematic daily checks and the knowledge to act fast when something changes. No panic required. Clear-eyed attention, yes. If this video helped, subscribe to Hundeo for more honest dog care guides. See you next week.